This is the second portion of your lecture. I'm now going to cover reproduction. And once again, as a reminder, you guys have an A&P quiz, quiz 2, that's going to be due next Saturday at 11:50. It's going to cover the senses and the reproductive system. And also next Monday, you guys will have an exam that will cover the introduction to anatomy and physiology, everything we learned in week 1, as well as these recorded lectures. So be sure to do all of your reading. Make sure that you're taking notes, highlighting note cards, however you need to do it. If anyone needs to have a study room, we can always do a Zoom study room. I can set you guys up in a group study room if you feel like studying together virtually. So that's no worries. I'll go ahead and set that up for you. Okay, let's go ahead and start. And let's cover the reproductive system. And these are your objectives, things that you're going to cover today. Okay. So now let's talk a little bit. We're going to get from basic to a little bit more complex. Let's go over the basics, okay? So within the reproductive system, we have our sex cells. And another word for them are gametes. So you may hear the term being used individually or interchangeably, rather. In women, that's going to be in men, it's going to be the sperm cells. So sperm make up the male gametes, or the male sex cells. And in women or females, we have the ova. And the ova are female sex cells. Now, when the sperm successfully fertilizes the ovum, we have the fertilization of those two sex cells that usually occurs in the upper 2/3 of the fallopian tubes. When that formation occurs, we then have the creation of a zygote. And a zygote is just the fertilization of two cells with the expectation of a baby. Okay, let's start with the gentleman. Let's start with our gentleman, and we're going to cover male reproductive first, okay? So now in males, the urethra serves two purposes. So here I'm going to use my little stylus here. I hope that you guys can see it. So this here is the penis. The urethra is this long tube, okay, and it serves two purposes. It's part of the reproductive system, and it is also part of the urinary system. So as you see the bladder here, the urinary bladder is connected. It is a passageway for urine. Also, for sex, it is the passageway of the semen as well. Okay, so we have the connection here. We have sperm gets shot through here, and then we have the prostate gland where we have some prostate fluid that gets shot in through there, and ultimately for ejaculation. So just know that the male urethra serves two purposes. It is what we call a urinogenital organ, and serves two purposes: for the passage of urine, also for the passage of semen. Okay, so now essential organs, ladies and gent, are needed for reproduction. They are the hallmark of the reproductive system, also called gonads. For gentlemen, that is going to be the testes. That's the main thing that is responsible for the propagation of our species. So, like I said, the testes, they house the gonad themselves, and within the testes, that's where the male is going to make testosterone as hormone. They will also make spermatozoa, which are those premature sperm before they kind of migrate and mature into a mature sperm. Okay, and testosterone. So we know testes are responsible for the creation of testosterone, as well as these premature sperm cells, which are called spermatozoa. Okay, now testosterone, ladies and gent, is the masculinizing hormone. It's responsible for the onset of puberty. So males are born with low levels of testosterone, but as a male begins to age and gets a little older, starts hitting puberty, those levels of testosterone begin to spike, therefore beginning the onset of puberty. And with puberty, we'll talk, she'll talk more so about that in growth and development. In males, when they start hitting puberty, they begin to have growth spurts. They begin to grow hair on the chest, under the arms, covering the genital areas. The voices get deep. They begin to pack on some muscles. Okay. Also, testosterone is needed for libido. So in order to have sex drive and desire sex, that you do have to have levels of testosterone. As males get older, those testosterone levels begin to drop. Therefore, libido begins to decrease as well. Okay. And then everything outside of the testes themselves are considered accessory organs, and they assist the testes in reproduction. And there are a series of passageways. So we'll talk a little bit more so when we go into like the spermatic cord, and we'll go into the vas deferens and things like that. So those are good. And also the external genitalia can be considered as accessory organs. All right, so let's go more so into the testes themselves. And I'm not necessarily concerned that you know all of these terms, but I'll go ahead and just touch on a couple of them. So for males, there are two testes located on the opposite sides of the penis themselves. They are housed within the scrotal sac, or the scrotum, which is the sac that sits underneath the penis. They are essential for reproduction. You must have working and intact testes in order to have reproduction. Within the testes themselves, ladies and gents, you have all of these little small, as you can kind of see, these little small ducts here, and they're just wound. They're exceptionally tiny, very small. Those are the seminiferous tubules, and they kind of coil and wrap and coil all around within the confines of the testes themselves, okay? The testes must sit on the outside, or should, let me not say must, should sit on the outside of the male's body, because on the outside of the male's body, typically they're about 3 degrees Fahrenheit or 1 degree Celsius cooler than the outside of the body. And this is where sperm and spermatozoa are housed. So spermatozoa are immature sperm, and they are ultimately, as they're moving and going through the seminiferous tubules, they're going to mature and become potent sperm. But they have to sit on the outside of the body because they rely on a much cooler environment. So that's why doctors will usually promote, or even you as a nurse should promote for gentlemen to wear looser undergarments, looser underpants, because you need to keep that area nice and cool. So boxer shorts if the need be, maybe cotton underwear if they're going to go with the underpants, the tighter underpants. You want to make sure that they're nice and cool, always cool and clean, okay? The outer covering here, this white covering here that houses the testes themselves, it's a tough membrane, and it's called the tunica albuginea, and it's a rough and kind of fibrous, rigid area that helps to protect the seminiferous tubules inside, okay? So we can talk a little bit about the function of the testes. Of course, because we said spermatozoa, those immature cells themselves that are in there, okay, that are floating around. The testes are responsible for the creation and the maturation rather of sperm. So that's the term spermatogenesis, is the production of sperm itself, okay? Spermatocytes or sperm cells doesn't necessarily that you necessarily have to know it, but know that spermatogonia occur with the onset of puberty. So that's when sperm cells begin to get potent, they begin to mature, and can possibly impregnate a woman. Know that the sperm cells, or the sperm cells only have 23 sets of chromosomes. They are the only cells of the human body to have half of them. That's because once it fertilizes the egg and creates a zygote, you're going to get 23 chromosomes from dad and 23 chromosomes from mom. Okay. Well, here we can talk a little bit about cryptochyroidism. In cryptochyroidism, ladies and gents, that is an undescended testicle. Sometimes if a male has maybe trauma, the testicle can get pushed back into the body. Or sometimes males are born with cryptochyroidism. So like if there's a hernia, and the testes get pushed up into past the hernia, normally just a simple surgery can pull it out, okay? Now, just because the male has cryptochyroidism and the testes is located a little further in the body, yes, it's warmer. Doesn't mean that they can't have kids. It makes it a little more difficult, but it doesn't mean that it doesn't happen, because there are many men that do have cryptochyroidism and then ultimately have children. So here you can kind of see more of a breakdown. Within here we have our seminiferous tubules, and they're just kind of migrating all the way through. Here's where all of the immature sperm cells have to go through these tubules and ultimately mature, with the expectation of coming around here to the epididymis. And we'll talk a little bit about the epididymis in just a bit. and then out of the vas deferens, and then through the urethra for ejaculation. Okay. All right, so this is a little bit easier picture. I do like this particular picture. It's a little bit better. So as you can kind of see, we have all of these little testes, I'm sorry, all of the little seminiferous tubules that are flowing through here. We have them flowing kind of through here. And then ultimately they're going to migrate here within the ready testes and then to the epididymis and then flowing outward. So it's just a little bit better visualization. Okay. Now know that when you see, you're talking about sperm cells, for the most part, human cells are normally just usually round cells or circular cells. Sometimes they could be cuboidal, but they're usually just a basic shape. Sperm cells are the only ones that utilize a tail or a flagellum. They are the only ones that utilize a tail or a flagellum for motility, because once the sperm gets ejaculated, it has to migrate all the way through the vaginal canal, through the cervix, up and through the uterus, till it ultimately gets into the fallopian tubes, where hopefully with good luck or bad luck, depending on what side of the fence you're standing on, we can have fertilization. Okay, so now let's cover the epididymis. And the epididymis, ladies and gents, sits behind the testes themselves. They also are tightly coiled tubes. If you laid them out, if you were to pull them out in an adult human male, they can lay about 20 feet long. They lay on the top side and the sides of the testes. So as you see, it kind of sits on the top side and then it migrates out on the side. I know I can't demonstrate it here with this arrow, but the epididymis sits on the top side as well as the sides, okay, the inside of the scrotum. So it can temporarily store a mature sperm. So when the male needs to ejaculate, there is readily made sperm sitting right here. But you have to be exceptionally careful when you're educating, especially, you're educating your sexually active teens and adults, because pre-ejaculate, which is designed for, ease and lubrication of sex, because there are live sperm that sit within the epididymis, they can ultimately get someone pregnant. So just because you have that pre-ejaculate doesn't necessarily mean that there's not sperm in there. There are very much live sperm and more mature sperm, more so than what's hidden or hiding here in the testes themselves, okay? The epididymis is the site where those immature sperms, remember we talked about the immature sperm that sit here within the seminiferous tubules, they mature once they hit the epididymis, okay? So we have very live and very mature sperm that sit there. The epididymis also secretes nutrients, because those sperm cells have to be fed. So it's sucrose and all kinds of nurturing nutrients that are needed in order to propagate and keep those sperm alive. Okay. Okay, so let's move on to the vas deferens. So now let's talk about the trail that sperm makes. So we start with immature sperm here within the seminiferous tubules of the testicles. Then they mature once they hit the epididymis. Now we have the epididymis moves into the vas deferens. And the vas deferens is this long cord here that ultimately feeds into the urethra. Now this picture just shows a vasectomy, and we'll talk a little bit about that, okay? So the vas deferens is this tube that permits sperm to exit into the urethra and out of the body. Okay, so as you see, it's attached to the sacral sac and enters through the abdominal cavity up into the penis itself. It's very thick, it's very smooth, and relatively muscular, because it has to ejaculate and shoot the sperm out at a high rate of speed in order to help the sperm get into the vaginal canal and ultimately up through for fertilization. Okay, now in this picture I'm just showing you what a vasectomy looks like. In this instance, for this particular vasectomy, this area they are cutting off a piece of the vas deferens, and they are creating an anastomosis. You'll learn all about anastomosis and things like that as you move on, and cutting this particular area. Okay. Okie dokie. So let's talk about the ejaculatory ducts and the urethra. So now we've migrated through the seminiferous tubules. We have moved up through the epididymis, and we now have mature sperm. Now we're moving through the vas deferens. So now as we move into the vas deferens, these are the ejaculatory ducts. So this is where the vas deferens is going to, remember I said it goes in through the abdomen, will connect into here and meet into here, okay? So that ejaculation can occur and out through the urethra, okay? So the vas deferens here meets at the ejaculatory duct. Okay, at the ejaculatory duct or the seminal vesicles, it's used interchangeably. Okay, joins here at the seminal vesicles and empties out. So we have sperm emptying out here. Okay, emptying out here. Now this is the prostate. We'll cover that a little bit. The prostate does contain a lot of fluid as well. That's going to bulk up the sperm as the man ejaculates. Okay. So here we're talking about that seminal fluid or semen itself, because remember, the sperm cells themselves come from the seminiferous tubules and the epididymis, but it needs an avenue in which to flow. It needs some kind of fluid in which to flow. So within the seminal vesicles, that's where the secretion, that's where that milky white secretion is going to join with the sperm so that it can come out at a rate of speed and help to facilitate movement of those sperm cells. When a man ejaculates, I know it may seem like a lot, but usually males only ejaculate anywhere from 5 to 7 milliliters, or about a teaspoon of ejaculate at one time. 3 to 5 milliliters of ejaculate, or 1 tablespoon at a time. And when a male ejaculates, there are anywhere from 300 million to 500 million sperm cells that come out. There are about 300 to 500 million sperm cells that come out. And to think only one makes it, because the female body is designed to destroy all of those cells. So, I mean, it's no wonder that we actually have children, because there's so many sperm cells that get ejaculated, and maybe 1, 2, 3 are the ones that get through and actually fertilize the egg themselves. Okay. For males, there is usually 1 prostate gland. And there are also 2 Cowper's glands. 2 Cowper's glands. This one might be a better picture. Let me see. No, not really. Okay. There are 2 Cowper's glands. And Cowper's glands help to secrete a substance that lubricates the urethra. It lubricates the urethra, and it also neutralizes urine. So once a male, remember we said the urethra is the site of both urine as well as ejaculate. Urine will naturally kill sperm cells, okay, because it is exceptionally acidic. So the Cowper's glands are going to secrete a substance that's going to help minimize that acidity so that sperm can live as the male ejaculates, okay? Also know that sperm is highly alkaline, so by placing acid on it, it's going to kill the sperm, okay? It's going to kill the semen and kill the sperm. Okay. Alrighty, so now we have the seminal vesicles, and the seminal vesicles, which are these guys here, these big guys here, okay, they are pouch-like glands, and they contain about 60% of seminal fluid as well. So remember what we're saying, we have, you know, that ejaculate that comes from the Cowper's gland that's going to help to neutralize the urine, and then within the seminal vesicles we have semen. So semen and sperm are 2 different animals. Sperm are the cells themselves. Those are the little tiny cells that you see with the little tails that wiggle, wiggle, wiggle as they move up. But then it mixes with semen, and by mixing with semen, that helps as that, you know, it helps to get those sperm to swim more easily in the vagina. Okay. Now, seminal fluid, which is that ejaculate, that creamy white stuff there, is usually yellowish or whitish kind of tinge to it. It's thick and it's high in fructose. It's very high in sugar because sperm thrive in sugar, right? That's one of those nutrients that we discussed that's going to feed the sperm themselves. Okay, now we will move on to the prostate gland. And the prostate gland is somewhat like, well, if you were looking at an irregular shaped donut, but it's somewhat of an irregular shaped donut, okay? And it kind of circumnavigates, I don't want to say, not circumnavigates, but it goes around the vas deferens and the urethra. So as you see in the gentleman We're moving this. So let's kind of get our anatomy together. We have the testes, we have the epididymis. We now have the vas deferens, which goes all the way up and around here and migrates here until it becomes the urethra. Around the urethra or vas deferens, depending on how large the prostate is this donut-shaped organ that's right here. Okay, and it is responsible for the secretion of a thin, milky alkaline fluid. Thin, milky alkaline fluid. It makes up about 30% of all of the seminal fluid. So men are getting fluid from all areas, right? They're getting from the Cowper gland, they're getting that fluid from the seminal vesicles, and then the prostate can give a little bit too as well. Okay, the prostate gland, when it secretes its fluid, it helps to activate sperm and helps them to be able to move more easily up into the vagina. Now, remember we mentioned that the prostate gland kind of circles around the urethra itself. Now, this is a normal, just to kind of give you a little more information, this is a normal prostate. As you see, the urethra itself is nice and wide open. It allows for urine. This is the seminal vesicle here, so it allows for the introduction of semen when the gentleman happens to ejaculate. Now, what happens as the man gets older? Sometimes the prostate itself begins to grow, or if there's cancer. So let's take a look at this one. As you see, this is actually prostate cancer. So in this particular stage, we see, well, yeah, we just have a little bit of a nodule there, but for the most part, these tubes are wide open, so you shouldn't have any problem with urination or ejaculation. But as the cancer begins to worsen, you see that these tumors are growing larger. Look at what happens to the urethra, and look at what happens here from the feet out to the seminal vesicles. They begin to get narrow. So this is where men that have enlarged prostates as a result of either, BPH or benign hypertrophic what am I trying to say? For BPH, I'm just having a brain fart there. But for benign prostatic hypertrophy, you'll see the enlargement of the prostate itself. Fluid can't get through. So the male's going to have trouble with urinating, either starting the urination or stopping the urination, or they may have problems with ejaculation or maintaining an erection. So as you see, it's getting worse, and it's pushing off those areas, pushing off those areas, pushing off those areas. So it makes it a little more difficult for the gentleman to urinate. Okay. Alrighty, so let's cover the bulbourethral glands. This is the Cowper glands. This is another word for the Cowper glands. And I know this picture is not the clearest, guys, but they sit right about here. They're usually small and pea-shaped, and we talked a little bit about those Cowper glands. Bulbourethral and Cowper glands are exactly the same. They're located just below the prostate, and if you remember before, they too secrete a fluid that goes into the semen that helps to neutralize the acidity of urine. Usually it is the pre-ejaculate. So as the man gets erect, these Cowper or bulbourethral glands are going to secrete that pre-ejaculate to kind of help and mix with the already existing mature sperm that exists in the vas deferens. Okay, so remember, like I said, we got to be careful when before sex, and you kind of fooling around, or the patient's fooling around, you have that pre-ejaculate. The reason that the male has pre-ejaculate is to help lubricate the penis for easy insertion, also to help neutralize it from any previous urine that may occur. Okay, so it helps to lubricate the penis itself and to neutralize any acid that might be located within the penis or within the urethra that could potentially kill the sperm. Okay. And then lastly, we have the penis itself, and the penis here sits right in front of the scrotum. There are normally 3 tubes here. We have these 2 corpora cavernosa, muscles right there, and then we have the corpus spongiosum, and that's the particular muscle that is responsible for opening and closing the urethra. Now, the corpora cavernosa are the ones that are going to fill with blood in an erection. So when the man happens to want, needs an erection with sexual stimulation, these 2 muscles are going to fill and be engorged with blood, therefore causing the erection. Okay. Now, on the penis, normally males are born with the prepuce, and the prepuce is going to be that foreskin. Now, people may, there's always a debate on whether to cut the foreskin of the prepuce off, whether it's a breeding area for infection, whether it's not, religious reasons, personal reasons, whatever. So, the choice is yours. There's now information coming out that it's not as infectious as before, and it causes more damage than before, but it's just something to kind of throw out there. If the foreskin itself becomes retracted over the glands or the tip of the penis, that is a disorder called phimosis, Phimosis. And if the penis is erect, it makes it very difficult for the foreskin to be retracted. So always encourage moms, if they're going to keep their babies uncircumcised, if they need to pull back that foreskin in order to clean under that area, you want to definitely make sure that you pull it back. Do not leave it, because what happens is the tip of the penis can become incarcerated, can cut blood off to the tip of the penis, and then may require medical attention. Okay. All right, now I'm going to move on to the ladies. And as we stated, the female sex cells are called ova. Okay. And ova are housed within the ovaries. Women have 2 ovaries, and I'll show you what they look like in a bit. Females are born with all of the ova that they are going to use for their entire lifetime. So there are millions and millions and millions of ova that women are born with, but only one gets released every month. So women have plenty of cells in order to propagate the species. If only one gets released every month, then you live for 70 something years, and for most of that you're not even releasing ova, only during menstruation and then right before menopause. Okay. And then we also have those accessory cells, and accessory cells are any series that come out of the ovaries. So the fallopian tubes, the uterus, the cervix, the vagina, the breasts, those are all considered accessory. Okay, but the main organ, the main female sex organ, are going to be the ovaries themselves. Okay. No, not the ova, the ovaries themselves. So let's talk a little bit about the structure of the ovaries. Like we said, women have 2. They're probably about the size of a teeny tiny, I guess like a teeny tiny plum, or even a larger of one of those cherry tomatoes. Okay, there are 2, so we'll have one on one side and you'll have one on the other side. They're usually nice and puckered. They're not even, so if you see that on an x-ray and it's smooth, that could be some kind of ovarian issue, cancer, things like that. So they're usually uneven and very puckered. They weigh about 3 grams, and they're shaped like an almond. So, they're pretty small. They are held up by ligaments. And within the ovaries occurs oogenesis, or the creation of the ovum. Oogenesis, or the creation of the ovum there. Ovum have 23 chromosomes, just like sperm, right? So when sperm and the ova come together, then ultimately we have that zygote, and the zygote now has 46 chromosomes, which every single cell, with the exception of that zygote's sex cells, are going to contain 46 chromosomes, half from mom and half from dad. Okay, so like we said, the ovary also have these little small follicles, or little hiding places where the ovum are hidden, and women are born with all of the ovum that they need from birth. So as soon as they are born, pardon me, even before they're born, as they're forming, they have all of those ovum within their bodies. Okay. If the ovaries get inflamed, usually because of a sexually transmitted disease or any kind of untreated uterine disease or vaginal disease, we have oophorytis. Most commonly, it's going to be from a sexually transmitted disease. And then we'll talk a little bit about primary follicles. And in primary follicles are ready for puberty. Okay, less than half of the ovarian follicles become primary follicles. So primary follicles are ready for puberty. So that's when the primary follicles are those that mature ovum with the expectation of release for menstruation. Okay. So let's go a little further into the functions themselves of the ovary. We mentioned that the ovaries are the site of oogenesis, so that's where the ovum are created. Also, it's where meiosis occurs. So meiosis is sexual reproduction. So that's the chromosomal mixing, right? So when that ovum secretes or releases rather, it's ovum with that 23 chromosomes. That's where the expectation that, well, even though it's more so in the fallopian tubes, where they're going to meet and ultimately create an organism with 46 chromosomes. Okay. Know that ovum are the largest cells of the body. Ovum are the largest cells of the body. Okay. Of the female body, rather. Okay. The ovaries are the site for the production of estrogen hormone and progesterone hormone. Estrogen hormone and progesterone hormone. Estrogen is for the utilization of secondary sex cells. So when estrogen begins to get secreted, that's when breasts begin to form. That's when the woman's voice may deepen a tad bit. That's when hair begins to form in those areas. Progesterone is the hormone needed. It's going to kick off menstruation. It's going to kick off menstruation. So usually estrogen begins to peak at whatever level it begins to peak. But it usually begins to peak 2 years prior to the peaking of the progesterone. So what normally happens in young ladies is you'll start seeing those breast buds and hair forming, and usually within 2 years after that, menstruation occurs because you have that spike of that progesterone that goes on. I'll talk a little bit about ovulation. Ovulation is the release of the ovum. Okay, so if there's no fertilization that occurs, within about 28 days, the ovum is going to get released. It usually will, once it gets released, about 12 to 14 days after ovulation, the woman will begin menses or her menstruation. So let's talk that through again, okay? So let's say that ovulation occurs on the 1st, and ovulation is only going to occur if the woman is not pregnant. So here's the 1st of the month, ovulation occurs. The ovum takes its own sweet little time and he moves down, or she rather, moves down the fallopian tubes, moves down the fallopian tubes, moves down the fallopian tubes. If no fertilization occurs, by the time that, usually by the time that ovum gets out of the fallopian tubes, menstruation starts. So if there's no fertilization and no implantation of the zygote, then the body or the uterus itself is going to begin to shed its lining, therefore menstruation. Okay. Alrighty, so here are the tubes themselves, the fallopian tubes, or the uterine tubes. They are the duct for the ovaries. So we have the ovaries on the end, and then the ovum, when it gets released, it moves down. Now, at the tip, the end rather, of the fallopian tubes here, you can kind of see them here, the fallopian tubes have what we call fimbriae. And fimbriae are little fringe-like or finger-like structure at the end of the oviducts, and it's like a funnel with little fingers on it, and it helps with the passage of the ovum themselves. So the fimbriae are like little fringe-like or finger-like structures at the end of this funnel, and they help to kind of facilitate and move the egg along. Okay. So the fallopian tubes are that route where the ovum is going to travel from the ovaries into the uterus itself. Now, if that ovum does not get fertilized, then, as we said, then the epithelium of the uterus is going to shed. If it does result in fertilization, the zygote is going to implant. Therefore, we're going to reduce progesterone levels because we no longer need menstruation. Okay. All right. Now let's talk about the uterus. Let's talk a little bit about the uterus. When not pregnant, the uterus is only about the size of a pear. It's very small, looks like the shape of an upside down pear. Okay, we have different levels, so because it's a very muscular organ, it has to be very muscular in order to facilitate birth, to hold the baby, and then to ultimately push the baby out. Okay. The myometrium is the thick, muscly layer within the uterus. It's what pushes the baby out during contractions. The uterus itself has two different sections, two different portions. It has the upper portion, which is the body, and then the lower portion, which is the cervix. Okay. The upper portion also, when there's a baby inside, called the fundus. Okay, and that's where the baby's going to be housed. The purpose of the uterus is for menstruation. If there's no fertilization, the endothelium is going to shed itself, and and ultimately bring on menstruation. The uterus houses the pregnancy, houses the baby. It's the site for where the baby is going to grow and be housed. And then lastly, it is the site of labor. So when contractions occur, and scientists still don't know what potentiates the onset of contractions, but nevertheless, when contractions occur, the myometrium jumps into play, begins to contract and push with the expectation of expelling the baby. Within the inside of the myometrium, we have the endometrium, okay, and that's the lining that sheds. Within menstruation, menstruation usually starts anywhere for young ladies about 11 to 12. But if you notice, if you have a daughter, or if you had, well, no, hopefully you're not looking if you have a sister, but if you have a daughter, if menstruation started about 12, she probably started getting some boobs at about 10. So usually it's about 2 years before. And know that the menstrual cycle occurs approximately every 28 days. Now, of course, there's irregularities in menstruation, but if you have a regular, you can set your clock to period, then yes, it's usually about every 28 days or so. And then on the other end of the spectrum, we have menopause, and menopause is the cessation of menstruation. It usually occurs at 50, but is occurring a lot more frequent in younger people who are having decreases in progesterone levels. Progesterone levels just kind of, the ovaries may just shut down on you, no longer producing progesterone, and then ultimately bringing on menopause a little bit earlier. Now we have the vagina, and the vagina is the opening tube. It's only about 4 inches in length, and it is lined with a mucous membrane. It sits right between the bladder and the rectum, and because I'm just trying to get, so we have the rectum right here, and usually we have the bladder sitting right here. So what happens a lot of times, well, not a lot of times, when mom is pregnant, especially as the baby moves on, the baby begins to push on that bladder, push on the rectum. So that's why moms have to urinate quite a bit upon pregnancy, may have to poo quite a bit, or you may even see hemorrhoids, because the baby is beginning to, like, the pressure is so elevated, it becomes, kind of makes those rectal vessels, or the veins themselves, just tortured because the pressure is so high, baby sitting on it, therefore leading to hemorrhoids. Okay, the vagina is the opening to the exterior, and know that sperm enter the vagina. Now, just remember, the sperm are very alkaline, the vagina is very acidic, so the vagina is constantly trying to kill the sperm itself. So that's why 300 million have to get released, with the hope that one will make it on up there. Okay, and here we have a little bit of the accessory glands here. Not really sure that you don't necessarily need to know them, but the Bartholomew glands, they're going to secrete some lubrication to help facilitate the insertion of the penis. They get secreted into the vaginal orifice, so it makes the vagina nice and moist for the ease of sex itself. And then for women, breasts have about 15 to 20 lobes that are arranged radially. They're arranged around the sides, around the inside of the breast themselves. And the milk secreting glandular tissue is responsible, that usually will formate with the increase of oxytocin that occurs when mom goes into labor and begins to start secreting or letting down milk. Okay. Usually the breast begins to enlarge during pregnancy. That's with the expectation of the production of milk. Okay. The areola, if you notice, in women is a different color than the breast. It makes it a lot easier for the babies to see, because remember, when babies are first born, their eyesight is not the best, but they can differentiate huge difference in shades and colors, right? So that's why they tell you when you have a baby, try to make sure that their toys are black and white because they can differentiate big contrast, which is why the areola itself is a different color from the breast so that they can locate it, right? It's kind of like a bullseye so that they can locate it. Also, the breasts themselves have glands of Montgomery, and those are those raised, bumpy areas on the areola. They help for the baby to latch on and to hold on with breastfeeding. So it gives the baby a little something to grip on because they don't have teeth. So it helps them to grip on a little bit better. And here's some more. We're going to talk a little bit about the external glands here. And we have we'll talk a little bit about the clitoris. And the clitoris is for sexual arousement. That's the main purpose of the clitoris. Okay. I know it says here on the urethra, usually the urethra is not part of externals because it's more internal for ladies. It's more internal, but there is indeed a picture of it here just so you can see it. This is the vagina, the vaginal opening, and the hymen in a virginal young lady or a woman who's not been penetrated. You'll see a flap of skin that locates in there. That's called the hymen. The hymen usually stays intact, but there are other reasons why it can come unattached. It can be from exercising too strenuous. You know, if you have a young lady who is a athlete, those occur. Bike riding, all kinds of things, right? Can dislodge the hymen, and then it does cause a little bit of bleeding because it begins to tear. We also have the externals, so we have the labia. We have the labia minora, which are their inner lips, and then we have the labia majora, which are the outer lips. And then we have the anus. Well, that's not necessarily part of the female genitals there. We also, if, for example, even though I have the term on here, the whole area down here is called the perineum. So we usually will call that the peri area or the perineal area or perineum. And lastly, if mom is giving vaginal birth and say the baby is a little bit larger than the vagina can handle, there can be a little slight bit of a tear. That little tear can be induced medically or surgically, or it can just happen. And in that instance, we're talking about an episiotomy. So episiotomy can be just naturally that the baby tears it, or it can be surgically induced with a surgeon kind of cutting that area to facilitate more easily birth. Mm-hmm. So now let's talk a little bit more so about menstruation. Menstruation, another term for it is menarche, menses. You'll see all of these terms used interchangeably. And we discussed it lasts about 28 days, but it varies in different women. So it depends on your hormone levels, stress levels, athletic ability, all sorts of things can make the difference in how long or how short your menarche is or your menses are. Okay, menses comes in 3 phases: menses, proliferation, and secretory. Okay, during the menses phase, that's when it's active bleeding. So that's when the uterus is actually shedding that epidermis, not the epidermis, the endometrium rather, and it happens about 4 to 5 days of bleeding. It is the first day of the menstrual cycle. So the first day that you're bleeding is the first day of your menstrual cycle itself. Alrighty. The proliferation phase occurs after that 5th day, right? So after you're bleeding, that proliferation phase, that's just kind of the mellowing phase. That's the build-up phase. That's where the follicle itself is beginning to build up with the expectation of the release of another ovum because fertilization has not occurred. And then we have the secretory phase, which is where ovulation occurs. So remember we said that ovulation occurs about 12 to 14 days before the start of a period. So the secretory phase begins when the ovum gets released up until it goes all the way through the fallopian tubes. If no fertilization occurs, then there is the onset of menses. We'll talk briefly. I'm not going to cover too much because we cover that more so in med-surg about the different hormones, but we'll talk a little bit about them here. The anterior pituitary gland, which is in the brain itself, and the pituitary gland sits in the brain. It has the anterior side, posterior side. The anterior side is responsible for the secretion of certain hormones. So it's going to secrete certain hormones and tell the body what to do. So for example, the anterior pituitary is going to secrete a hormone called FSH, or follicle stimulating hormone. And when follicle stimulating hormone gets secreted through the anterior pituitary, it tells the ovaries that they have to secrete estrogen. Okay, so depending on different changes, if mom is pregnant or whatever's going on, if the young lady is intimate, things like that, it's going to go up and down depending on the needs of estrogen. Also, the anterior pituitary will secrete a hormone called luteinizing hormone. Luteinizing hormone, okay? And luteinizing hormone promotes the maturation of the ovum. So it's what gets secreted with the expectation of the maturation and growth of the ovum itself. Okay, so let's go over that again. The FSH is going to start the release of estrogen, and we need estrogen also not only to kind of mitigate and control those levels. FSH starts the development of the primary ovary. So remember we discussed primary ovaries. Those are going to be the ovaries that we use for ovulation that occurs during puberty. So you'll see high levels of FSH that will promote increases in estrogen. When FSH gets secreted, it's going to mature the ovum themselves with the expectation to make those primary ovary follicles more mature so that they can release the ovum. And then we have LH rather, or luteinizing, which promotes the maturation of the ovum themselves. It is responsible for ovulation. It is responsible for ovulation. It's responsible for ovulation. Okay. And then let's talk a little bit about birth control pills. Now we know if FSH is responsible for the development of those primary the primary ovarian follicles, we know that it helps to release the ovaries to release estrogen. We know that LH is responsible for the maturation of ovum. It's responsible for initiating ovulation. Birth control pills are going to suppress those hormones. So depending on the different types of hormone pills that you're on, many of them can suppress follicle stimulating hormone, they can suppress luteinizing hormone, they can suppress both. Okay? And the most effective form of birth control is, of course, abstinence, but we can also use surgical procedures like a hysterectomy where the doc can pull out any of those important, like those necessary ones, so they can either pull out the ovary, they can pull out the ovaries themselves, they can pull out the cervix, anything that's responsible. Usually they're going to pull the ovaries or at least sever the ovaries, so if they do get released, they're not going anywhere. They're not going to go down the fallopian tubes because they're going to snip the tubes themselves or ligate the tubes themselves. So even if the cells ovum are released, they're not going anywhere because there's no tube in order for it to migrate down. And lastly, we'll talk about menstrual abnormalities and pregnancy abnormalities. Amenorrhea is the absence of menstruation. So amenorrhea can occur, with times of stress, with the onset of menopause. If the young lady is going through premenopause, you can have amenorrhea, or if she's pregnant, because if you're pregnant, then there's no need for the shedding or proliferation of the endometrium, okay? And then we have metrorrhagia, and in metrorrhagia we have bleeding in between menstruation. These are not active menstruation, so this is normally not active menstruation. Sometimes it could be something wrong, sometimes not. So anytime if you have a normal menstrual cycle and you see some breakthrough bleeding, then you may want to go ahead and check with your doctor just to make sure everything is okay. And then we have menorrhagia, where you have abnormally heavy and long menstruations. So if you have a woman that's bleeding more than the 5 days and it's heavy, 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 you can see all sorts of abnormalities, right? You may see anemia because they're losing blood, or iron deficient anemia because they may be losing blood. You may see drops in blood pressure. You may see some dizziness. You may see some increases in heart rate because the body's trying to compensate for the loss of blood. They may be tired, lethargic, and kind of sleepy and dopey. So those are things that you may see with menorrhagia. Then we have dysmenorrhea, and dysmenorrhea is painful menstruation. Now, menstruation is normally a little uncomfortable. Sometimes you'll get cramps, you'll get headache, you'll get backaches. But with dysmenorrhea is that painful menstruation, where these poor women unfortunately can't go to work. They're on heavy pain medications for menstruation. They just want to kind of crawl up in a bed and just die during those areas, during those times. And then in pregnancy abnormality is ectopic pregnancy, and that is a pregnancy that occurs anywhere outside of the uterus. Now, ectopic pregnancies are going to more commonly or most commonly be found in the fallopian tube, whereas if the ovum moves down and it moves down, and normally we said it's in the upper 2/3 of the fallopian tube that it occurs. But if the fertilization occurs, oftentimes maybe a little further up, and it doesn't take the zygote long enough to move down, it can implant directly into the fallopian tubes. And if that occurs, unfortunately, the zygote is going to grow directly in the tube. So you're going to have a lot of pain going on with that woman. They could rupture if not caught early, the woman can rupture the fallopian tubes. Then they'll have to be forced to have, repair, or forced to have a hysterectomy in order to remove the zygote as well as the diseased tissue. So definitely, if mom's having pains like that and no menstruation, you want to start thinking ectopic pregnancy and how to fix that. Okay. Alrighty, so just as a reminder, you guys will have your 3-minute paper that's going to be due on Saturday, so make sure that you upload that for me. And that's it, okay? Enjoy your weekend, and I will see you guys tomorrow. Bye-bye.